Hello everyone, how are you? Welcome to the physioBRAIN channel. This is Professor Adriano, and today we're going to give you 3 more exercise tips for those who have had a hip replacement. So stay with us and follow along with this information. And don't forget, go ahead and subscribe to the channel, like the video, and share it with anyone you think needs to know this information. So if you haven't seen our first video about exercises for those who have had a hip replacement, the link is up here. You can click on it and follow along, right? I would actually recommend that you watch that video first and then come back to this one. So pause this one if you haven't seen it, watch that one, and then come right back here. If you've already watched it, let's get started. We're going to share 3 more exercise tips to help us recover after a hip replacement, okay? Always remember that each exercise, each prescription should be made individually by each physical therapist, right? So consult your physical therapist. If you are a physical therapist, this is just a way for us to provide general guidance. If you are a student, you know, these are tips meant to spark some ideas, and I'm sure this will help with your treatment plan, okay? So these are 3 simple exercises that don't require any equipment, any instruments, nothing complicated. We can work with what we have at home, at the patient's house, or in your own clinic, okay? So in the previous video, as we mentioned, we had some initial exercises, and now in this one we have some slightly more advanced exercises, but they are all part of the entire rehabilitation process for hip prosthesis, all right? So for the first exercise, we can use something that slides easily, let's say something that can glide on the bed, on a mat, or on an examination table-y thing that allows it to slide when you move it, okay? So for this one, we're gonna do the following. Ask her to bend her leg here to the side. Then with this leg, we're going to ask her to pull in and stretch out. Here, we've used a notebook, okay, which can be used for this purpose. So go ahead one more time, pull in and stretch out. Once again, pull in and stretch out. And we repeat this about 6 to 8 times at first. If it doesn't get too tiring and there's no pain, we can gradually increase and progress with more repetitions at the beginning, all right? It's important that she always performs the movement in a controlled manner. That's why a surface something that's slippery, so to speak, but also a little unstable is good because it increases neuromuscular recruitment there, all right? The second exercise we can do is to keep her in this position and move the leg out to the side and then back in. Go ahead. Open and close. Open and close. One more time, just like that. This way we eliminate the effect of gravity, and we're able to work not only the joint, but also the hip abductor muscles, which are essential for regaining the ability to stand and walk later on. All right, so these 2 exercises are essential in the rehabilitation and recovery plan for hip prosthesis, okay? And now the last exercise we're gonna do in today's video, this final instruction, is to have the patient in a position of slight hip flexion so that the knee is raised a little. What for? Here we're going to start introducing the effect of gravity. We were doing the movement against gravity, but still without any added weight, right? So using just her body weight, ask her to extend the knee and lower it. So lift and lower. That's it. We can do several repetitions, right? Starting with 6 to 8, then gradually increasing the number of repetitions and sets. But here it's interesting to notice and consider that we can work at various angles. I can work with just a pillow, for example, so I have a smaller angle, right? A greater range of motion. The higher we place it, the greater the angle we can work with, and we end up recruiting different muscle fibers throughout the exercise. So it's important for us to keep that in mind. 3 very simple and essential exercises in a hip prosthesis rehabilitation plan. All right? So 3 extremely simple exercises, right, that I'm sure will greatly help in your treatment, in your patient's rehabilitation plan. I hope I was helpful. I hope I contributed in some way. If you like the video, subscribe to the channel, subscribe if you haven't already, and share the video. Let's share and spread this quality information to as many people as possible, right? I'm always available. A hug, and I'll see you in the next videos.